Okay, it's Carl Small, the SOT preliminary protocols. First, we're going to do a distortion analysis. And your patient turn face the wall that way. Okay, first we're going to have the doctor sitting with the patient facing the wall. I'm going to take my thumb and use those crosshairs on the acromion. And we're looking for sway greater than 1/4 of an inch, forward and backwards. And sway greater than 1/4 of an inch is indicative of a category 1. Next, have the patient turn and face the wall to the left. Okay. Now we're going to take your thumb and crosshairs. Can you lift your shirt up and place it at the S2. And we're looking for 1/4 of an inch sway left or right. Okay, which would be indicative of category 2. Next, we're going to have, if the patient comes in and presents with an antalgic lean with no pain, that's going to be indicative of category 3. Okay, next we're doing the first rib palpation. We're going to find the T1 and find the rib tubercles. Spread out to the rib tubercles. Have the patient fully flex and extend 2 times. Go ahead. Okay. With a bilateral movement, if the patient has bilateral movement with tenderness, it's going to be indicative of a category 1. Patient with unilateral movement or tenderness is going to be indicative of category 2. And patient with no movement due to muscle guarding is going to be indicative of category 3. Okay, cervical indicators. First, we're going to palpate the cervical spine. Pain in the TVPs relates to the lumbar spinous. On rotation to that side. Pain at the side of the spinous relates to the lumbar TVP's inferiority on that side. Okay. Category 1, patient bilateral C3 laminar tenderness indicates a potential Cat 1. And Cat 2, C4 left laminar tenderness indicates a potential Cat 2. For the patient, palpable spinous and transverse process for each vertebrae in the cervical spine for tenderness. Tendon spinous relates to the lumbar TVP inferiority. Tender TVP relates to lumbar rotation, and that's indicative of category 3. And next is cervical compaction. Doctor is at the head of the table, patient supine. So we're going to support patient head and lift feet together and lift the feet 18 to 24 inches down. Next we're going to compress the head and lift feet together, lift again 18 to 24 inches. Okay. If there is with cervical compression, if it's easier, then that's indicative of a cervical problem. We're going to address that now. Okay, we're going to do cervical step. We're going to support the patient's head, and we're going to look for a restriction or smooth motion at any of the closing of the facets. And if there's a restriction at the C7, T1 junction, we're going to address that with an anterior thoracic adjustment at level T1 and T4. So we'll go S to I. C7, T1, 6, 5, 4, 3, 2, 1. Okay, next we're going to analysis and correction. And we found a restriction at C5, C6. We'll go up there. And we're going to do a figure 8 motion. And reverse it. Okay, next we're going to do the basic 1, and we're going to support the patient there with the phenom, and we're going to find the EOP and go 4-finger flat contact, nuclear line, and we're going to palpate for the pulses, the equilat, both lateral left and right. Takes process about a minute. Okay. Next, we're going to do basic 3. On basic 3, we're going to palpate this sagittal suture for tender nodules. And once we find a tender nodule, we're going to cross the thumbs across the sagittal suture, and put your fingers, flat tips at the parietals, and have the patient take 3 deep inhales and out, exhales out. As the patient inhales, this patient exhales, separating the sagittal suture and pulling on the parietal. Okay, next we got analysis and correction for Cat 2 psoas. Doctors behind the patient at the table. Your arms out. Make sure there's no watches or artifacts on the arms. Have the patient to extend the arms and have a square base. Extend your fingers and traction the arms back. Place them together and line in front. Okay, the patient has a short left arm, which is indicative of a left psoas major. So we're going to go to the contralateral side, and I'm having you to lift your knee forward. And ask the patient permission. Do I have permission to go on your leg and stabilize your pelvis? Okay. So next you go under the leg, stabilize the pelvis, and with a knife edge, go into the psoas. Have the patient take 3 deep breaths. Blow it out. And as they exhale, you go deeper into the muscle. And the last one, you strip out the muscle. Okay. And you check. Arms. Patient's arms together. Even base. Track back. Hands together. And wherever you can hands. Okay, we got the anterior iliofemoral ligament. Patient at the foot of the table. Patient supine, adopted at the foot of the table. And we're going to take the ankles, legs, and we're going to, at the heel of the foot, and rotate internal, looking for restriction. See which one is more restricted. The most restricted is his right leg. So next we're going to go over to the contralateral side, and we're going to have the patient to internally rotate and find the brachial trochanter. Okay. And with a double finger contact, rotate the leg internally, and we're going to slowly rotate out. We'll do this 2 times. Okay, move back. Okay, on the last rotation, I want you to rotate fast, and we're going to do a fast stretch. On the count of 3. 1, 2, 3. Okay. All right. Next, we're going to recheck. Okay. And we'll have a slight improvement on the internal rotation. Next, the arm fossa test. Have the patient make sure you're not touching anything. And on this side, we have the patient hold your hand up, make a light loose fist, palms facing in. All right. First, we're going to test the arm. Hold. Okay. Next, you take your other hand and put it on the umbilicus and find your pubic symphysis. And make sure you move your male anatomy from it.
Good.
Okay. Nope. Push your hand back. Okay. Palpate the inguinal ligament. Okay. Next, we're gonna hold, touch, and we're gonna pull. Okay. The upper fossa. Next, we're gonna go to the lower fossa. All right. Hold, touch, pull. Okay. All right. That's right. Next, we're gonna go clockwise rotation around the patient. You want to do the same thing to the opposite side. Make sure you're not touching. Okay, hold. And have you take your other hand and find your pubic symphysis. If you need to move your male anatomy.
Good.
Okay. Put it back on time. Okay. Test the upper fossa. And hold. Okay. Hold. Touch. Pull. Okay. Test the lower fossa. Hold, touch, pull. Chen, no? Okay, anything, less than, 5, muscle test, it's gonna be indicative of, CAT 2.